Hello and welcome to another edition of the Osteopathic Lyceum podcast. I'm going to go through a phrase that I came up with when speaking with a friend. It really points to a lot of what happens in hands-on manual treatment with respect to treatment that is more likely to work more likely to work on purpose than more likely to work by accident. So the phrase that I came to, because my friend was talking about an approach to something where they were trying very hard because they were very goal-oriented. They wanted to get the whole thing done, and they didn't mind putting a bunch of effort into it. And then they recognized that if they backed off and they tried to do the same thing in smaller chunks, it worked way better. So the phrase that popped into my head was do things the way they work, not the way you want to do them. So the way they work would be best described as, say, related to the barrier concept and really paying attention to how the patient responds to what you're doing. So they either say ouch, they don't say ouch, they protect themselves, they don't protect themselves. The tissue gets tighter without them protecting themselves, or you make the soft tissue soft. Whatever ends up happening here. But that's the way that it works, as opposed to the way that you want to do it. So the way that you want to do it would relate well to things like having a technical approach or a technique system approach. So you are somebody who likes myofascial release. So you do myofascial release. You find a certain problem, you're like, this one is best suited for MFR. It's essentially premature closure. So if you look at decision-making literature, it's premature closure. So this is cognitive bias literature, keeping in mind that I do have pet peeves with how most people use the term bias or cognitive bias. It is mistaken thinking that you do not know you're making if you are the individual doing the thinking. So we can observe it and we can describe it. Premature closure is a good description of looking at a circumstance, coming up with a solution, and stopping there, not necessarily figuring out if other solutions may be more appropriate. You just sort of go to the one that you're most used to. This is also experienced utility. So you've used a move many times, it's worked. You didn't notice whether or not it worked by accident, worked on purpose. You're convinced that it worked on purpose. You just go to it. So you could be like, oh, well, when the person has these complaints, I automatically think cranial. So you go cranial, or you automatically go visceral, or you automatically go to facilitated positional release, or whatever it happens to be. You're doing it the way that you want to do it. So it's much more top down than it is bottom up. Now, it is very, very difficult to make the argument that anything works exclusively top down or bottom up. But what I would say is that with respect to hands-on manual therapy, you should sense what's happening first with as many senses as you can. So vision, hearing, hands, or palpation or haptic feedback, with as many senses as you can, and then let the top-down stuff do something with it. Because that's kind of how it works. It goes from sense to brain, brain to motor. If you are taught to think in the chunks that would well relate to techniques or technique systems, then you're probably going to be more likely to try to do it the way that you want to do it. So it'll go up, you'll think technique system, you'll go after it, as opposed to, okay, here are the ways that I make choices about how this responds. You can choose a hold because of the area that you're working in. So I talk about wrapping and reinforcing hold. So often you'll wrap right around something and you'll reinforce. So it's like two of your arms on one of their limbs. And then you go to work. Or something like you wrap around and you grab yourself so that you pin their limb against your body, between your body and your arm. And then the other hand is sensing the area that you're working on. Now that sensory hand really is something that is often found in osteopathic approaches, less often found in other hands-on manual therapy approaches. It's not that it isn't found in other hands-on therapies. It's that osteopathy, it has the sensory hand that some people will call the wedge or the fixed point, almost always there. That sensory hand or the fixed point hand or the wedge hand ends up providing you with palpatory feedback, haptic feedback, so you can sense if the tissue is getting a little bit tighter and they're not protecting themselves, which is fine, that's direct. If all the soft tissue is going soft, because if it is, then you're doing indirect. You can find that information to judge whether or not the patient is responding the way you want it to. So if you try to create shoulder flexion, so you try to bring the arm straight up forward in front of the body in the sagittal plane, and the muscles jump, they grab. Well, you can't do it that way. Now, if you rotate the humerus in some way, and then you bring it up through the sagittal plane, and you can get through most of the motion without the patient jumping and protecting themselves or contracting, then you're doing it the way that it works, not the way that you want it to work. Because if you think technique, humerus goes straight up, if you're using technique first and barrier, then you just go short of where they jump, they grab, they protect in the move that you know. Whereas if you say, okay, my aim is to create movement of the humerus in the sagittal plane as much as I can without them protecting themselves, that's where you're going to be more likely to be more willing to use auxiliary movements outside of the plane to get what you're looking for on behalf of the patient. You're restoring the motion that you found restricted in the way that it works, not the way that you want to do it. If you think it has to be patient active, then you just immediately go patient active. One of the things that I've been able to observe across time as people are learning patient active approaches, especially in the way that I teach it, because I teach not necessarily trying to use the body region or body part that you're working on for the contraction. I break it down into relational motion. So one thing stays still, one thing moves in relation to it, where when you contract the area that you're working in, it tends to be uncomfortable. So instead of turning the neck and having them counter rotate, what I would do is I would have them push the right shoulder back and then the left shoulder back. So it's a still neck, moving torso. But I would go further. I would say, try also pushing the lower limbs into the table, because that can create torque through the vertebral column, which would then move the torso in relation to the table under the still head and neck. What happens is people go to the first one that they test, and if it feels like it did what they wanted, they stay there. My suggestion is you still need to test the rest of them. So let's just say we're working on the neck. We twist the head one way, we push one shoulder in, then the other shoulder in. In the initial example, push one shoulder in, it feels like it did something, and then you just stick with that shoulder. My suggestion is, more broadly, push the right shoulder, push the left shoulder, push the right leg, push the left leg. Be organized in how you're attempting to approach generating that activating force, so that you can figure out which one approach or multiple approach to activating forces works most appropriately for the patient in that moment. It allows you to get more of the motion in the direct barrier without the patient protecting themselves, or it helps you make the soft tissue softer, whichever one. But if you just stop at the first one that you do because it felt like it worked, then you're doing it the way you want to do it more than you're doing it the way that it works. You really have to explore multiple options once you've chosen the area that you want to work on, once you've chosen the hold that you'd like to attempt to work with first. You don't simply stop at the first stop. You take a lap, you check what everything's doing, or you take a metaphorical lap around all of the permutations that you have available to you, roughly. Figure out which one works the best for the person in that moment. Use that. And funny enough, let's just say it's the left shoulder into the table that works the best. It'll work well for 3 contractions, and then it'll stop working. Then you retest the right, then you retest the limbs, because things are going to change such that when the first one that worked best stops working best, check the other ones to now see how they're interacting with the hold. Because one of the other ones that is unexpected may work well after the first one that worked best stops working best. So you still have to continue to explore. So once the method or the approach stops working the way that it was, re-explore. If nothing is connecting, if nothing is doing what you want, now you know you need to move on to another method, as opposed to just sticking with that method and waiting longer. Sometimes you do have to wait, especially if you're doing something that's a hold. If you're doing something that's kind of a stable hold-based approach, yeah, you got to wait a little while and then retest. And if it's going the way that you want it to go, maybe you go back to it. If it's not going the way you want it to go, give up and go to another one. But the reason you know you should give up and go to another one is because you tested, right? So you have to be willing to consistently explore and re-explore within a given method as you're doing it, as opposed to just staying with the method. and the first time you did it. If you stay with the first time you did it, one of the things, again, that you're doing more of is you're doing more of trying to do it the way you want as opposed to the way it works. Figuring out the way that it works really, really is about comparing and contrasting in an organized way. So one of the heuristics for assessment and treatment is be organized. Comparing and contrasting in an organized way between the permutations of activating forces in whatever hold you've come to based on your assessment to identify the region that you should be working. So if you don't explore and show that you've figured out which one sort of unlocks it all the best, whether it's passive activating forces, compression, distraction, torsion, and shear, so squish, pull, twist, and slide, whatever happens to be available to you in a given hold, because in some holds, you may be able to compress and distract, but not slide, so you may not be able to create a translation, right? Or a shear, rather, you may be able to create a twist or a rotation. In some, you may be able to create a compression meaningfully, but not a distraction meaningfully, so you only have certain ones available to you. But be organized in how you explore them, because one of them or a combination of them may work the best, but you don't know until you try it. So you have to be organized in trying your passive activating forces. And then you can move over to the active activating forces. So trying to figure out where it's most appropriate for the patient to contract their body and move their body away from the still thing that you're holding on to. Because when you contract the thing you're working on, it tends to be much more uncomfortable than if you contract the body in relation to the still part that you're holding on to. The exploration is the key. The testing of which method, which activating force or forces work best together for the patient in that moment is the key to figuring it out. It's one of the reasons, again, why I suggest a heuristic-based approach, right? So that you have a set of possible solutions you can test between, as opposed to an algorithmic approach, which is a set of steps generating a guaranteed solution, because it just doesn't work that way. So if you look at some of the videos that we have up across time, you'll see that I'm beginning to show more of the same move on multiple bodies so that you can see how the same intended outcome, the same movement, has to be done differently between myself and multiple people, and how sometimes I have to be in plane, sometimes I have to come somewhat out of the primary plane I'm trying to work in. Sometimes I have to make a bigger move, sometimes I have to make a smaller move, sometimes I have to change my position in relation to whoever I'm working on, because it's more about knowing what the outcome goal is, so the movement that I want to create, the sensation that I'd like to create in my hand with respect to the tissue or tissues that I'm working on, and then all of the little things that I may or may not have to do in order to get it to click for that person in that moment. So if I don't do the exploration in an organized way, then I may just stop at the first thing that I try that feels like it worked and miss all of the other ones that could work better. My hope is that I can motivate anybody doing hands-on manual therapy to be more organized, to test more things before they stop and stick with a method that seems to work the best in that moment, as opposed to just doing it the way that you thought of or tried first. Check a few things real quick, see what works, see what clicks the best in that moment. Use that until it stops giving you some of the net response that you're looking for. Recheck it. Either it changed the way you wanted it to or it didn't, so reassess it as best you can. Then if it changed a little bit, but you think maybe the same method could give you a little bit more, well, recheck the activating forces. You'll find the new thing that clicks. Often when somebody's quite experienced and they've onboarded this concept and they practice it a lot, it looks really smooth. It doesn't look like much. It's just kind of a little wiggle here, a little wiggle there. And then it starts to work again, right? They reset. They'll reassess, they'll reset. It's really quick once you get used to it. Initially, it'll look a little clunky. It'll look like you're thinking, which is totally fine because it should, because you are. Then you tune into that person in that moment. You get a good result, and you can move on. But it really allows me to solidify or maybe boil down all of that into another heuristic. Now, the barrier concept really is a heuristic. Don't make them say ouch. right? Because you know that you're trying to generate a particular motion in a particular area, but you need to go through in an organized way and use a variety of movements and activating forces in order to either add tension to the tissue without it protecting itself, especially in the restricted range, or make the soft tissue soft depending on how they respond. Now, that depending on how they respond is the thing that will allow me to have the discussion about the phrase that popped into my head in relation to discussing stuff with my friend, where I said, you got to do it the way that it works, not the way that you want to do it. The barrier concept is that thing that allows us to have some way to choose to do it the way that it works as opposed to the way that we want to do it. So if you're doing osteopathy in the way that it seems to be most functional, you're using the barrier concept well, you're making those choices, you're using those methods, you're testing in an organized way, you're activating forces when you're treating, you're being very organized in how you approach assessment, you're doing it very much on purpose, as opposed to when somebody says this thing to me, they say, neck, I do these things only because that's what the muscle energy teacher taught me, or that's what the cranial teacher taught me. No, I want you to pull back a little farther, have a good organized approach to all of this, be it assessment, be it treatment, because if you're organized and you test your activating forces, you'll figure out which ones work best in that moment. When they stop working, you have an organized way to figure out which one will give you more, or if nothing will give you anything, you know it's time to move on. So thank you for listening again. Hopefully you learned something, and we'll talk again soon.